And feel welcome to jump in the chat and tell us where you're coming from. We're excited that you're here and excited that you're joining us. So please feel free to get to know your new colleagues and peers. Okay. Maybe one more minute, Amy, and then we'll jump in. Does that sound good?
Sounds good.
Okay. For anybody who's just joining, please feel free to introduce yourself in the chat. Let us know where you're coming from. We just heard from somebody who just graduated. And so we're thrilled to have you here. And we'll start at 5:02. I'm just waiting for it to change. There we go. All right. Well, good evening or afternoon, depending on where you're coming to us from. My name is Rachel Nosko, and I'm part of the field faculty here at the School of Social Work. And I'll be one of your presenters. I've been in this role since 2016 and placed for various hospital and healthcare settings since I've been here. And so I'm excited to be here with all of you. And I'd also like to give both Amy's a chance to introduce themselves as well. Amy Vantine, do you want to go first?
Sure. Hi there and welcome. So glad to have you here. We're always excited to know of students that have interest in healthcare and hospital-based placements. I'm Amy Vantine, use she, her pronouns, and I have been at the School of Social Work for just about 4 years. Prior to that, I was at Michigan Medicine, the local hospital here on campus, for quite some time, over 20 years, working in a few different areas, but primarily in pediatrics and obstetrics, and worked with students almost all of those years that I was there, and always loved working with students. So did make the change to come work with students full time a few years back, but I'm still loving being really connected to some of these healthcare-based placements. So excited to talk with you about those.
Thanks,
And I'll
Amy.
pass over to, Amy Brandt.
Hi, everybody. You'll hear a little less from me today. I do have some hospital sites. Most of them are around the aging pathway. Please forgive my random kittens that want to pop onto the screen today. I have been at the university since 2004. I worked in student life for quite a while, in sexual violence. And yeah, if you are indeed in the aging pathway and you're looking at medical placements or hospital placements in general, feel free to reach out to me directly. I'm going to put my email in the chat, but I will also be with you moderating the chat today. So if you have any specific questions, I'll be answering those. But you'll hear my voice a little less. Good to see you all today, though.
All right. So just a few housekeeping items. We are recording this, so it'll be available to you to listen to again, and also to share with others and those who couldn't make it today. The captions are available to you should you need them. So please feel free to turn those on if that's helpful to you. And yes, please put questions in the chat. We are going to have a Q&A at the end, but we're going to try really hard to have us wrapped up by 6 o'clock so that people can move on with their days. So I'm going to hand it over to Amy Vantine to kick us off.
All right, thanks, Rachel. Okay. So we are going to be talking, although we'll have some more detailed information about some types of placements, the goal of this seminar is really to talk about healthcare-based placements in general and give you some broad information about what social work and healthcare is about and give some general information about some of the placements. But we won't be doing a huge deep dive into a lot of the placements, particularly oftentimes students have a lot of questions about Michigan medicine placements, and we'll go through a little bit of that information here, but we will be having a separate webinar specifically for Michigan medicine. Which I'll have that information in the slide deck for you in a little bit as well. But the goal of this webinar is really to talk about healthcare-based placements more generally, and then again to give a few highlights about some areas, but to be able to give you the bigger overview picture. And so just really wanting to start off with a little bit of a kind of a rhetorical question, just for you to think about yourself. Social workers in healthcare really work in a variety of settings, and just to be thinking for yourself, what do you imagine a social worker in a healthcare setting? What comes to mind for you when you think about social work in a healthcare setting? Just give you a moment to kind of think about what comes to mind first. So as I have here on this slide, social workers work in so many different environments when we talk about social workers in healthcare. You can see that in this setting here that there is very high acuity medical needs in terms of like intensive care units, where you see there's a person who is connected to a ventilator. You can see those that are being cared for virtually and receiving healthcare services in a virtual environment. Outpatient, where patients are coming to a clinic visit, as if most people are familiar with coming for a regular doctor appointment, like a healthcare appointment when you're not feeling well. So in outpatient settings, there's general medicine, and then there's specialty care. So people that have kind of chronic health conditions and are coming to see specialists. And healthcare is from birth through older adult and through death, and so really ranges the whole spectrum of ages as well. So when we think about social work in healthcare, there's not one way to be able to describe that, and that's one of the things that we want to really be able to. Oh, there we went through all the slides. Be able to kind of talk through with you here, and so. How do we think about then this very large, overwhelming kind of thought about what is social work in healthcare? We want to break it down a little bit and want to talk about medical social work and psychiatric social work. So start with medical social work. Social workers can be working with patients and families both in an inpatient setting, in a hospital setting, and outpatient, or we also use language around ambulatory care. That's the same as outpatient. So social workers can be in both of those settings. Social workers in more medical healthcare areas are working with an interdisciplinary team. So often working sometimes with other social workers, but in large part working with other disciplines. So physicians, nursing, other therapists like occupational therapy, speech language therapy, physical therapy, other kinds of healthcare specialties as well. Medical social workers, and when I'm saying medical, I'm thinking about more physical medical conditions, are completing clinical assessments, often doing a lot of psychoeducation, doing a lot of providing a lot of information and education to patients and families. There's a lot of adjustment to illness counseling, whether that is a new diagnosis that somebody has or a chronic health condition where things continue to be shifting and people are learning to adapt to new challenges or limitations that they may be facing. So adjustment to illness counseling is very common in medical social work. Complex care support and advocacy, a lot of times patients have more than one thing that's going on. And so being able to really help them navigate really complex needs and complex situations is a kind of a key thing that medical social workers are doing. There's also a lot of work within vulnerable children and vulnerable adult safety and welfare. So there's often a lot of assessment around kind of those safety parameters for patients. Grief and loss is a very profound part of this work. And when I talk about grief and loss, it's not just about loss from death. Grief and loss is really apparent in every area. Somebody coming in with something that they're concerned about, they're having some new symptoms, there can be a lot of fear. If they're getting new information about a diagnosis, they can be experiencing a lot of grief and loss in those moments and ongoing as well. So that's a big part of that work. Linking patients and families to community resources, really kind of bridging between maybe more acute healthcare to what their next level of care is going to be is a big part of social work practice here, as well as kind of helping to manage these cases. So I also now want to think about social work in the psychiatry setting. And integrated healthcare, which means looking at the whole person, looking at a patient from the lens of both physical and mental health care, is a much more common practice now. And yet in healthcare settings, there's generally more of a primary focus. And so that's why I want to be able to differentiate between medical and psychiatry. Yet, again, I just want to emphasize that in a lot of areas, there is integrated health where social workers in particular are really looking at that full picture of what are medical conditions as well as any mental health psychiatry needs as well. So I just kind of talked through the medical. Now in psychiatry, social workers in the psychiatric area can also be working inpatient psychiatry units, or outpatient or ambulatory care. Or there are also partial hospital programs where patients will come for kind of day treatment, where they come for a day, but they go home at night. So there are lots of different kind of settings that social workers in psychiatry may be working in. Social workers in psychiatry are also often working on interdisciplinary teams. They are working with physicians and nurses and other healthcare team members from other disciplines as well. They are often completing clinical assessments. They are providing a lot of psychoeducation to patients and families. Depending on the location or the type of care that's being provided, social workers may be doing kind of individual therapy sessions. They may be doing groups or family sessions. And again, that can really vary depending on the type of environment that a social worker is working in. Psychiatric social workers are also looking at what are child safety and welfare needs, as well as vulnerable adult. They are also assessing and providing support around grief and loss. Again, any kind of new diagnosis can have that experience, or challenges that somebody is facing on an ongoing way, or other support people in a patient's life as well, providing a lot of support that way. Social workers are also linking to community resources, and they are also helping to manage really complex cases and complex care as well. So I wanted to talk about each of those separate because they're often in separate locations, but I want to put these two side by side because what I really want to emphasize is that while people generally identify what area in healthcare they're working in, you can see that there's a lot of overlap. Much of what's on each of these slides is the same. And so one of the things that we really want to emphasize, and we do this across the board, not even only for those that are in healthcare-based placements, but regardless of where your placement will be, the skills that you're going to be developing and the social work competencies that you will be working toward are going to be the same. The way in which you may engage in those things and continue to develop these skills may look a little different based on the location or the patient population that you're working with. But as you can see these side by side, those skills are going to be very similar and they will be transferable so that where you would be placed does not mean that that's the only kind of work that you'll ever be able to do as a social worker. So really wanting to value and have more of a focus on what are the skills that I'm developing and how might I be able to get those.
Okay, so back one slide, Amy. So in addition to the different kinds of work that might happen within healthcare settings, the training formats also vary from institution to institution. And that could be anything from the number of placements that are offered. One site might have 2 or 3 versus something like Michigan Medicine that can offer 10 or 20, and it changes every semester as they consider what their capacity could be. They may have differences in interview process or timelines right now, and I'll talk about this in a minute. We're working on the VA hospital applications already for fall, and so just that timeline, because the VA timeline is different, we have to adapt to their needs. They're not necessarily adapting to what our school's needs are, so we just need to know that, right? You may have 1 or 2 field instructors within your particular site, And you may stay on a unit or in a placement the entire time, or you might be in a placement that has some rotations and you're moving around within the organization to get exposure to social work practice in different areas within a health system. They may have formal training programs and attendance requirements. Some do and some do not. And this information you'll find in the database as you start to select and look at and review placements soon. And then also there are different schools of social work who are also connected to and receiving field placements at those sites, right? So Michigan Medicine brings in students from Eastern Michigan University, a university that's only 15 or 20 minutes away from us. And so we don't necessarily have the hold on all the health-based placements within the state of Michigan or in any particular location, that those are shared among schools of social work. Next slide, please. And so here are some of the other opportunities that you might be exploring in terms of hospital-based placements or medical placements outside of Michigan Medicine. Sometimes we hear students get really focused on, oh, I want to go to Michigan Medicine. I've heard so much about that. But many of our partners have amazing learning opportunities that they also provide, but maybe are less familiar with students who are local or even those who are coming new into Ann Arbor. And they also might have multiple sites, right? So Henry Ford Health might have 2 or 3 different locations. The VA has I don't know, like 4 different cities that they're located in. So you might see healthcare placements that are not in Michigan Medicine, and we also champion those and think that those are great environments. It's really about what placement is the right fit for you based on all the needs and requirements and your pathway in learning. Next slide.
All right. So as I said, we're going to have a separate session specifically for Michigan Medicine next week. But I do want to just give some, again, very broad general information to try to help answer some early questions. So placements at Michigan Medicine can be kind of in a variety of places. So there are medical placements that, again, as I said, many of these are integrated health. So as a medical social worker, you also would be doing some mental health work as well. And in psychiatry, you often have patients that also have other physical health needs, but they are kind of divided between these 2 areas. So on the medical side, there are adult outpatient and adult inpatient opportunities, as well as pediatric inpatient and outpatient. And in psychiatry, the same, adult inpatient and outpatient and pediatric inpatient and outpatient. The number of placements that they may have available varies from semester to semester. It depends on the availability of field instructors. And so while these are generally kind of the areas where there are often placements, we're not able to guarantee a placement until we get that information from Michigan Medicine specifically. But I also want to be able to highlight the first list there. Those are really focused on micro practice. So those that are in the interpersonal practice pathway, or those that are in the child and family pathway, or the older adult pathway. So those are really more of the interpersonal practice placements. But Michigan Medicine also does offer some macro placements in areas of healthcare like dentistry, social work administration, Silver Club, which is an older adult program, and then Office of Decedent Affairs, which is working after death care for with families. And the students that are in these more macro placements are still part of the Michigan Medicine student program. A lot of that program has a lot of connection with interpersonal practice, but that can be really great learning for students in all placements. And these placements are, generally speaking, for most of these macro placements, are often a mix of both micro, so the more kind of interpersonal practice and other similar pathways, and meso. So many micro students can be in one of these macro placements at Michigan Medicine and be able to still can have that considered to be a placement within your pathway. There is typically less direct patient contact than in some of the more traditional, more micro placements, but there is often kind of that mix of macro work along with micro work that can be a really nice blend for students that either just have larger interests of perhaps being exposed to some things outside of that direct practice with patients, or also students that maybe haven't gotten their first choice of a placement, but they would be interested to consider some of these kind of macro placements. They have a mix of more interpersonal practice as well. So the fall placements that we've been told about up to this point right now, and things can change up until when our applications open. But at this point for fall, there's adult medical, pediatric medical, adult outpatient care and psychiatry, and as well as child and adolescent psychiatry. And then in terms of some macro placements, there is Office of Decedent Affairs, the social work education program. So for those that may be interested in kind of more healthcare management kinds of things. And then MOXIE, which stands for Michigan Oncology Quality Consortium. And that's a placement that really does a lot with oncology patients around the state of Michigan. And they do some, again, more macro work, but they have a real nice connection to patients on a patient board, and they're really developing tools and information for providers throughout the whole state of Michigan. So really nice opportunities in lots of different areas. Michigan Medicine does have, as Rachel spoke about, some of the placements do have student programs that are specific. Michigan Medicine is one of those. What's important for students to know is about Michigan Medicine placements. Students are required to be in their field placement 24 hours a week. So that is more field hours than what is required for most students for graduation, but students are using some of their elective hours to be able to account for additional field time. So again, that's something that we could talk about more specifically and will in the Michigan Medicine specific session, but just wanted to mention that because sometimes that is a key piece of information that tells students whether or not this could be a fit for them. And Michigan Medicine includes several hospitals together, which is the University Hospital for adults, Mott Children's Hospital, Von Voigtlander Women's Hospital, the Rachel Upjohn Building, which is a large part of the outpatient psychiatry. And then there are other medical satellite locations in lots of different areas locally as well. So that student required training program, the 24 hours a week that students are required to be in placement, 4 of those hours are part of the student training program. So students are in their specific placement 20 hours of the week, and then the other 4 is part of that student program. The student program includes things like mentorships, which are smaller group meetings that are on specific topics that range from some direct kind of clinical practice to larger systems thinking. There's some clinical skills trainings where students are able to practice completing full assessments, psychosocial assessments. And then there's some additional sessions, a Breaking Bad News simulation that's partnering with students from the medical school. They hold social justice grand rounds and then other kind of large group meetings as well. And there are also preceptorship opportunities where students are able to spend some time in other areas of Michigan Medicine to be able to get some of that additional exposure. It is important to know that if Michigan Medicine is one of those placements that you want to pursue, that the training program, the student training program is required, and that these are set days when the student program is held. So it would be important for students that want to pursue Michigan Medicine to make sure that these are days that you would be able to be in field specifically. In the fall, the days for the student program are Tuesdays from 8 a.m. till noon. And in the winter and spring summer semester, the days for the student program are on Thursdays, again from 8 to 12. So the Michigan Medicine information session we're going to hold is May 6th. We'll go into deeper dive for information about Michigan Medicine placements. So if you are interested, please do register for that session as well. And again, we'll speak more specifically. And we have the program manager for the student program at Michigan Medicine, as well as the director for the student program there will be attending this session to be able to help give additional information and answer some questions as well. All right, so as I said, we're going to do that real deep dive for Michigan Medicine in the other session. But it's really important for us, and Rachel said this earlier, we have wonderful, fantastic healthcare placements outside of Michigan Medicine. And so again, while we won't go into these in great depth at all and with all of them, we just really want to emphasize that our students have excellent experiences at so many placements. And we really want, well, we're going to highlight a couple of them here. We really want to encourage you to kind of explore the database when you're completing your field application, to really read about the experiences that are available at other kind of healthcare-based placements as well. I have so many students that have had just expressions of tremendous learning and opportunity at places with all of our healthcare-based placements, really. So, but I do want to highlight a little bit about Children's Hospital of Michigan. And the reason I want to highlight this is because we often have students that are really interested in working in pediatrics in healthcare. And because of some logistical changes that have been happening at Mott Children's Hospital, we haven't had nearly as many placements in pediatrics in recent semesters as we once did. And so I want to be able to highlight that Children's Hospital of Michigan is an excellent training. They have an excellent training program for students. I have a large handful of students that are there each semester. So I want to highlight for those that are really interested in pediatrics. So Children's Hospital of Michigan is a freestanding children's hospital in Detroit. They provide inpatient care, outpatient, medical, and behavioral health. I will say that more of their focus is on physical health for most of the placements that we've had, but we do have some placements that do have that integrated health with behavioral health care as well. And students have been able to get some exposure to some therapy as well with patients. Students here do work on interdisciplinary teams, and so they have the opportunity to work with peers and mentors from other disciplines as well. Again, physicians, nurses, other therapies, and have had really wonderful experiences. As they are considering students, they hold their interviews in kind of a different format, where they do kind of speed round interviews with the field instructors that are going to be accepting students for a semester. Students that are interested simply apply for Children's Hospital of Michigan. You don't apply for a specific unit in the hospital, because their focus is more on matching the student with the field instructor, so the person that the student would be working primarily with at the placement. So the student goes and interviews, very brief interviews. I think it's like 8 minutes with each field instructor. And then the student kind of ranks what their highest interests are. And then field instructors are also ranking where they think is a good fit with the student. And that's more so how they make those determinations about student placement. So it is a little bit of a different interviewing kind of process. Children's Hospital does also require 24 hours a week in field. And so again, there would be using some elective credits to be able to account for that additional time in field. But just as with Michigan Medicine, I've always heard students that are placed at Children's Hospital feel like that was a really good investment of their elective hours. So want to mention that. They do have a small student program. It's not as large and structured as what's at Michigan Medicine, but they do have a number of students, again, not only U of M students, but also from other universities as well. And they do bring those students together to be able to have speakers come in and have learning that's happening about particular topics. And they also offer preceptorship opportunities. So students are able to go to different areas of the hospital that's not their primary place to be able to get that additional exposure as well. So want to be able to highlight that. I also, we've had some students that have written about their experiences in a way to be able to communicate to other students about what those experiences are. And so I'm not going to read through these, but when we'll post these slides and you'll have an opportunity to read through them, I just kind of titled this "Worth the Drive," because I think a lot of times people think, I'd be really interested in Children's Hospital, but it's in Detroit and I'm in the Ann Arbor area. That's just such a long drive. And it is. I'm not going to say that it's not. It is a long drive, but students have felt like it was worth the drive. And although it was many, many years ago that I was in graduate school, I was living in Ann Arbor, and my placement, while not at Children's, it was at Henry Ford Health System in downtown Detroit. I made that drive to my placement all the time. And so I know I can feel for people saying that's a long drive. It is. And I would also say, and I've heard from many students, it really is worth the drive. It is a great investment in your learning, particularly if you want certain kinds of experiences. So please take time to kind of read through these comments from other students and see if that's something that kind of resonates with you. All right, Rachel.
Okay, so we're going to also highlight the VA because it has its own little quirks. So the VA, there are two primary VA locations that we are connected to locally. And they are the Ann Arbor VA, and their sites include offices in Ann Arbor, Flint, Jackson, and all the way in Toledo, Ohio, which actually is not that far from us. And so same with Michigan Medicine, they give us a list of placements that are available. I think they had 9 available for fall. And some of you may have seen emails about expressing your interest early so that you could apply. The Detroit VA also has placements available. In general, they are looking for winter start students. So they would be starting in January. And Amy Brandt is the liaison for those particular sites, and I manage the Ann Arbor VA. Everything that you've already heard about healthcare-based placements are true for the VA. So they also have a kind of a smaller training program where they pull together all the students from all universities to talk about and teach around medical social work and the role of the social worker within the VA system. But they are already in their interview process. So those who applied early are in the process of interviewing now. I don't know how many of those students will land, and I don't know how many applications they received. So if you are planning or are hoping to have a VA placement in the fall, it would be really helpful if you could email me. My email is right there on the slide, rtmackey@umich.edu, and let me know so that we can talk about or even see if it's possible to throw your application in the ring. I'd be happy to have that conversation. And also, I just want to recognize that there may be people on this call who are actually winter start placements. And so I won't be able to tell you too much about what the application process will look for the VA for the winter starts. I will tell you that it will probably start early for the Ann Arbor VA. So I'm guessing early fall, they will start to seek your applications. And we will send emails to your UMich email letting you know what the process will be for Ann Arbor VA placements that start in the winter. Amy Brandt, is there anything you want to add about the Detroit VA for winter?
If you are really, really burning to get into the Detroit VA for fall, reach out to me. I just put my email in the chat. I'm happy to try to negotiate that with them. They do sometimes like take on like a random fall student. So just reach out to me directly and we can have that conversation. I'm happy to advocate for you.
Thanks, Amy. Okay, next slide, please. So we're going to talk a little bit about registration for hospital-based placements, but I want you to know that if you are feeling a little confused about this, that is okay. There will be more information coming forward, and we talk about it quite a bit in the webinar and then also when you do your pre-field orientation. So we do just want to highlight though that it's common for hospital-based placements to require additional field hours, and it's usually noted within the database that you'll be reviewing about what those schedule requirements are. Placements that are requiring the 24 hours a week, like Michigan Medicine, that will impact your registration and the number of field credits that you're earning. And when you are confirmed with a placement and have finally gone through the interview and we've finalized it, we'll be sending you more information. Part of the role of the field office, both your field faculty, but our amazing team that helps us make this ship run, we'll always be looking to see do you have, or are you meeting the requirements? So just know that we work together with students to make sure that their registration is appropriate for the placements that they have. The requirements for field is outlined on by your program plan. And so you have a program planning document. You can see what the requirements are there. For example, if you're an advanced standing student, you're required to have 12 credits of 691. However, all other students are going to need 14 credits. And I bring this up mostly because there'll be two sets of requirements: the requirements for graduation and then requirements for the organization. And so we will help you to understand and meet both of those. The other thing I would say is make sure that you're reading all the emails that we're sending to you. And we're going to have some reminders coming up. But a lot of times we're communicating information that maybe because you haven't started the program yet, you're not paying as close to attention to your email as you might when you're here in the fall. So just know that we'll be sending the field office as we place you. Email will be a major source of information, including registration information. Next slide, please.
All right, so we also want to briefly mention that for any healthcare-based placement, whether that's a hospital setting or a community healthcare-based setting, there is a required course that we have students take. This Social Work 714, which is called team-based decision making, and it's a collaboration with other schools within the university. So it's with the medical school, pharmacy, dentistry, and School of Nursing as well. This is an interprofessional service learning course where students are put into teams with other students of these other disciplines and are really learning skills and are able to practice what it's like to work on an interdisciplinary interprofessional team. And so this is going to be a 1 credit course next year, and it's only offered in the winter semester. It's on a Wednesday afternoon at 3 o'clock. And so it's, again, another important thing to keep in mind, but this is for any healthcare-based placement, that this is an expectation that students will be taking this course. It's been, I would say, most students have really loved these learning opportunities. There's some really helpful kind of tangible tools that students have been able to start using immediately in their field placements, and has really helped to make them feel more comfortable and confident about having these interprofessional kind of discussions, conversations, and to be able to advocate in different ways as well. So just wanted to mention that this is something that you would be expected to take if you're in any of the healthcare-based placements.
In addition, there are some requirements that are really part of the onboarding process for healthcare-based placements, and they often have to do with documentation and immunizations or collecting information about you so that you can be in these environments. The field faculty will do our best to communicate with you about what is required for each individual placement. What is required for Michigan Medicine is different than what is required for the VA. And so, again, we'll be asking you to submit these items ahead of your start of field. Because you will not be able to begin them without it. And for the VA, let's say, they actually want you to have those in like right away after you accept your placement, because it has to go through a large federal organization to get approval. So it can take several weeks to do that. So again, whether it's your immunizations, a TB test, a tetanus verification of tetanus, a drug screen, or a background check, all of those will be required in order for you to be able to start your placement, depending on the requirements of your unique placement. And again, our field faculty will help you sort through that or give you points and how to move forward. All right, so some tips, and we're getting close to the end, so get your questions ready. we know that you went through the webinar, and we know that we hope that you know that there is writing support available to you. We want to emphasize that sometimes we see in these health-based placements, people will talk about their own health history or how personal stories that have impacted their decision to come into the healthcare setting as a social worker. We are asking that you do not write about those specifically, but almost to think about this document as a description of what you want to learn and why you're called to do that particular area of work in healthcare. Please follow the directions on the Office of Field Education webpage and write up, like I said, write about why medical care or a behavioral health setting. Please remember that inpatient placement, so like if you go into an inpatient psychotherapy, like an inpatient unit for psychiatry, that they're not doing those 25 or 50 50-minute traditional sessions, that those generally will happen in outpatient settings. So read the descriptions that we offer to you, and then decide kind of what you're interested in based on what descriptions are offered. Please don't name any specific hospital or placement in your goal statement. You're going to submit those to us through the electronic application, and then as we're reviewing those, we're giving that information over to the site. So it's helpful because you don't want to necessarily have to revise your goal statement every time. If you don't get your first choice, you don't want to have to go back and revise it. So please try to keep your goal statement without reference to specific hospital or placement names. And also do not reach out to hospitals directly. They have all been with us for some time, and they know the routine. And when they get outreach from our students, they know that they are supposed to direct them right back to us. You don't want to be the person who's not following directions. So please do not reach out to hospitals or any placement directly. Let your field faculty do that work for you. Please come to us with your questions, and we're happy to meet with you and talk with you and guide you through this process. If you're interested in opening up a specific site, please reach out to us immediately, because that process itself can take several months. And as you're thinking about your actual writing of your goal statement and your selections that you'll be making in the application, go back to what Amy was talking about earlier. Are you really thinking about psychiatry and mental health, or are you really leaning towards a medical or physical health context? Think about the population that you're interested in: pediatrics, adults, or older adults. Understanding that humans are humans, right? And you'll be practicing the skills that are necessary to work with all people as you move through your MSW program. Consider your willingness to drive. The reality is that lots of students want placements that are close to them, whatever that means. And sometimes there are more students than placements available. So if you are able to drive and open to driving, consider that might make an opportunity available to you that might not be available to somebody who doesn't have a car or cannot drive. Please be mindful of timelines and deadlines. We really mean it. When we say that things are due, they really are due. And behind the scenes, we're already starting to review applications and get them ready to be batched over to whatever organization they may be going to. So please be mindful of timelines and deadlines. If something comes up for you, please let us know, and we can help coach you on how to navigate that. Don't be afraid to review the field webinar and follow those directions specifically. We've been doing this for a very long time, and even today I'm taking notes on questions and things we might adapt. So we're always trying to get better. But having you make sure that you're listening and reading the information that we offer to you is essential for your success in this process. And then finally, remember the goal of the placement process, right? This is not an employment preparation opportunity. This is a a learning opportunity, and learning can happen in lots of contexts. All of you will be leaving, hopefully, with an MSW degree that allows you to practice in a variety of settings. And so if for some reason you don't land on your first choice or your second choice, know that we are here to help you to see where the learning is available and how you might transfer those skills from one context to another. Next slide.
I just want to add one thing to that too, is that I think a lot of times people feel very certain that they know exactly where they want to be placed. And I just think about a student that I had a few years back who she was so passionate about wanting to work in a neonatal intensive care unit. And she said, but I just have to be in that placement. We didn't have any of those placements available. And so we worked together and she landed in a pediatric oncology, so cancer placement. And wouldn't you know it, by the time she graduated, she said, I cannot imagine not working in cancer care for, children. So I think sometimes when students are placed in a placement that was not necessarily their ideal placement that they were hoping for, you can learn a lot about yourself and about other interests that you may not have discovered otherwise too. So it's often a really positive thing to be in an area that you had not anticipated.
And I just want to go up to this question from Natalie, that the question is, if we're incoming fall 25 students, but our field placement application is due on May 23rd, how are we going to take the Social Work 714 webinar in the winter? Don't we need to take it ahead of time? The answer is no. I'll let Amy add on to my response, but remember that you are a student. When you get into this field placement, we know you are students, your field instructors know you are students. You are not going to know how to do things, right? That is okay. This is not a job where we're expecting you to come in and already have preparation. You're going to be learning and integrating coursework into your field placement this entire experience. So the answer is no, you will not need to know, take it ahead of time, that you will be learning along the way. Amy, is there anything else that maybe Amy teaches that, so she probably has some wisdom to share too?
Yeah, I mean, I agree. We have students that are in all different places in their learning. And that's true of all social work students, but also students from other disciplines as well. And so there will be some students that will be in the course that will have been in their field placement for a while and maybe have already some practical experiences to bring to that class, to bring to those discussions. And others will maybe have just begun in their field placement. So people will come from a variety of experiences, but that just adds to, I think, the course as well. So I think that's a really good question. Unfortunately, the course is only offered in one semester. There's a lot of coordination with the other schools. So it is only offered in the winter semester. So that is the only opportunity and option to be able to take it then. It is a good question.
Yeah, great question. All right. So we've finished up our content presentation for you. What are your questions? Don't be shy. Go ahead. Sona, is it Sona? Did I pronounce that correctly?
Yes, Sona.
Nice.
Hi.
Hi.
So I have a question about the field hours. You said that we have to do 24 hours a week. Does that mean that we finish field quicker or the same amount of hours, which I think for advanced setting is like 672?
Yes, so it depends on if you are in a field placement site like Michigan Medicine that requires 24 hours a week, you will be doing that for all 3 terms, and you will accumulate extra credits that can be attributed to your elective credits if you want. Field is designed to be spread out over time so that you can integrate coursework in your field experience. So you will not be getting done earlier. We actually count hours equal credits. And credits are only, and hours are only attributed to a single term, right? So you won't be doing all 600 plus advanced standing students in one semester. We're spreading those out over time. And they belong to that particular semester because there are credits attached to it. So this is one of those things where I think the most important thing for you to know and plan for is that, one, there are some placements that are going to require more credit, more time than your graduation requirements expect, and you are agreeing to that as you apply. And all students are usually in field no fewer than 16 hours and no more than 24 hours in a field placement. There are some weird exceptions out there. And I guess that's the other thing I would say is that, unfortunately, field is not something where you can turn to your partner and say, hey, what's the registration for field again? Because it might not exactly fit your predicament. So come back to field faculty to talk with us about what your needs are if you have questions as you move forward. But we'll keep talking to you about this. The field registration is always something that people have lots of questions about.
Thank you.
Alex.
Hey, can you hear me all right?
Yes.
Perfect,
Hi.
thank you. This isn't super fully formulated, but I'm a macro student, specifically research and program eval. And so I'm curious if you'll talk a little bit more about, one, the social work ed program at Michigan Med, and then about any other of the macro or research eval specific placements at other sites that you may have.
Yeah, yeah. Well, I won't talk in total depth just because we'll talk about that a little bit more at the Michigan Medicine session. But I would say the social work student program is, I would say, more management and leadership in that pathway. But there could be potentially for a student that has interest in wanting to do something unique and specific around a student program, I think that's something that they would be open to exploring. So I think if you would have some ideas about things you might be interested in to be in a placement like that, I think for that placement in particular, I think they'd be very open to considering what those opportunities would be. So you could reach out and talk with me about that. And then I think about the MOXIE placement that I talked about, the Michigan Oncology Consortium, Quality Consortium. They are doing a lot of evaluation research in that work. And so that might be one for you to take a good look at that description.
Thank you. And just a quick follow-up, I wonder about opportunities for kind of shaping or creating a new placement and how that process can look like a couple months. Is that something that I guess, who can I explore that with?
Do you mean a new placement in a new organization or an organization that we're already connected to?
A program or new organization outside of the ones that you mentioned or the ones that students are currently in.
Okay, so for us to open any new organization, there is a process that needs to happen. The University of Michigan has to have an affiliation agreement with whatever other entity that is. And so we generally would say it's to be planning for around 6 months to be able to have things kind of from the beginning to end. And we also would say it's never a guarantee. So depending on the organization, there's often a lot of back and forth between our Office of General Counsel, our legal office here, and whatever the legal office is of the organization that we're trying to create an affiliation with. And so a lot of times there's back and forth around the language around how we will be affiliated with one another. And so sometimes those things can happen much more quickly than others, but we always want to caution students that it can be a lengthy process and without a guarantee, at the end. So I think if there's a particular interest that you have, I would say to contact our office and be able to, one of my colleagues just put that in the chat, to contact our office and someone can have a conversation with you more specifically around that.
Awesome, thank you.
Yeah, absolutely. Great. Olivia.
Hi, I don't know if you can hear me very well. My internet keeps saying it's unstable, but my question is that to give some context, I was interested in more of the macro social work as well. And I was interested specifically in like the VA or just in kind of just exploring my options. And I was wondering first if I would have to take that class that you mentioned, still being placed within a medical or something a facility, even if I'm still doing like the more macro-esque route? And then two, do you typically have those placements available in a more of a macro like kind of setting within the VA? Because I'm really interested in it's like policy work or just policy work within like healthcare and stuff like that. So I just wanted to know those two questions. And then also, sorry, it's a lot. And also if you guys had a kind of placement that was more of a meso level where I could still work on the macro level and policy aspect of it, but get some interaction with people that are, you know, clients or people that are just involved with the organization.
So one thing I think we maybe haven't said today, but probably should, when the application opens for all of you, you're going to be able to go in and search by your pathway, and you'll be able to say things like, you know, IP, healthcare, behavioral health, stipend, on a bus line, all these things, and the system will sort for you. And so some of the questions you're asking about specific placements, that information will be revealed to you when you can get to the database. I have two pro tips. One is to first start with just your pathway and your program. So if you are IP and advanced standing, I want you to first just go in and click those two buttons and see all the results that come for you. And then as you kind of want to narrow your search, you can go back in and say, okay, IP, advanced standing, and I want healthcare and policy. And then it will sort those. But the more specific you get, the narrower the list will be. And sometimes I'll have students say, well, I only got one placement. I'm like, well, what did you put in there? And they put in like 10 different things. I'm like, well, that's probably why. So start off broad and then narrow down, and you'll start to see. The other thing is that, you know, these placements they're with real life people, right, who are doing real life work. And so there might be, and I can say this for myself, I'm also a field instructor. I happen to offer a placement myself. Sometimes I'm tailoring what I'm doing to fit the student's interest, right? So I guess I would also say, like, especially for my macro friends, you want to read those descriptions. They're going to tell you a little bit about what they're offering. And I also want you to go in with an open mind, because you don't know what might be happening in an organization. And they're updating those as frequently as they can. But again, these people are all volunteers and they all have full-time jobs. And so I caution students to, like, try not to have this ideal image of what will be, but to be open about what is available at this time. And the interview process, I think, also helps students to really understand what this could look like. And it's a great time to be thinking like, oh, I'm open to doing IP work, or I'm open to like doing that meso macro. I love that. Like when we hear that, we're like, ooh, that's great. We can help you figure it out. We'll have sessions where you can come and talk to us more about once the application is open. The VA in general does not have a lot of meso macro opportunities. There were none listed, but what I would say is that a lot of times they are in programmatic places that are, so I'm thinking about a placement called HUD-VASH, which is working with homeless veterans. So they're definitely not at bedside. They're not necessarily working in psychiatry. They are out in the field finding veterans who are unhoused and working with them in that space. And that's a whole program, right? So to me, in some ways, that's more meso than it is really, you know, a micro case management or like interpersonal interaction kind of opportunity. And I think when you start to read the descriptions, you'll start to have a better understanding of like the breadth and depth of what it can look like in each individual field placement.
And then I can just answer the question about the class, the team-based decision-making class. Yes, any student, whether you're micro, meso, macro, if you are in a healthcare-based setting, the expectation is that you will take that course. I am a person in a healthcare setting. I did a lot of interpersonal practice work. I also held a macro position. And the skills that are being learned in that course are about working on a team. And you work on a team whether you're doing micro practice or macro practice. And so while the examples in large part that are being used in the course will be more kind of interpersonal practice, patient care, again, it's the skills that you're building are transferable to working even when you do macro work. And so we try to not have things siloed so much between what's macro and what's micro, because as social workers, we really do all of it. So yes, I think that's a fair question, but all students in all healthcare-based placements are expected to take that course.
I just want to note that it's 6 o'clock. And so for those of you who need to log off, we're not going to be presenting new information. We're just taking questions. I'm happy to stay a little bit longer and see if we can get all the questions answered, but I just also want to say thank you for joining us. And we look forward to working with you over the summer as we kind of sort through the placing process together.
Yes, thanks for joining us.
Okay, Natalie, I see your hand raised.